Vets of Geelong, our family caring for yours.
To all our animal owners out there, it's Dental Awareness Month historically, and so today I'm talking about the importance of dental disease in the animals that present to us coming into Vets of Geelong. It's surprising that of all the consults we see coming in, a massive portion of pets do present to us with some form of problems associated with their mouth. It's a bit like if you go to the dentist for bad breath or anything like that. Most of the pets that come in, and statistically they say 80% of the pets over the age of 3 are likely to have some form of problems in their mouth. So 80% is a lot of our clients. And what does that look like? For the pets coming in, it can be anything from as simple as a little bit of plaque on their teeth, some redness on their gum, a fractured tooth, a tooth root abscess, and anything in between. And not every pet actually have to go to far as to say, not many at all, necessary to tell us or tell their owners they're in some form of pain. It's surprising how many pets would come in and be treated by myself and the team and walk out with amazing oral hygiene after the fact, and their owners comment on how much happier they are. So it is something to bear in mind. When your pet comes in for a consultation with one of the veterinary or nursing team, they will assess your pet's health, particularly its mouth, if you're in for a dental nurse check and so forth, but have a chat. What typically involved is lifting your dog's lip or your cat's lip, checking under the gums and trying to get a bit of a view as best we can to assess it. As you're aware, not every pet sits still when we lift their gum. Sadly, some do try and bite us, but luckily we're trained to have quick reflexes. So there might be circumstances where the team are suspicious of something they saw, but we can't be 100% accurate until your pet's in for their examination under anaesthetic. So what's typically involved is if the team notice some form of disease in your pet's mouth, so whether that be plaque through to a fractured teeth or anything in between, the pets would typically come in, they'd have a pre-anaesthetic blood test taken that morning to determine they're fit for the anaesthetic or any concerns you might have during or after the anaesthetic. They then are all anaesthetised, they're given all their happy drugs to make them as comfortable as we can. Under the anaesthetic, all the teeth are descaled and polished. They're all probed to check to make sure there's no problems under the gum surface that we can't visually see. There'll be a portion of pets then which we proceed on to do dental x-rays, again checking for their old tip of the iceberg saying stuff happening below the gum margin. Because there'll be a portion of pets that may present to us with lesions in their teeth where the bone's eaten away or a fracture in their gum margin which we otherwise didn't see. Any pets requiring teeth to come out would typically have local anaesthetic nerve blocks placed in strategic places to minimise the discomfort. The teeth are then surgically extracted if that's what's indicated, or if they're broken and so forth, they're all removed. There are circumstances where if the teeth enamel is damaged but we don't actually have proper damage to the teeth, we can actually do some bonding to save their pet's teeth, because it's not all about removing the teeth necessarily. After that, you tend to find any teeth that are taken out, the pets will have surgical gum flaps to close off the sockets which are exposed. Some would argue a pet coming in under anaesthetic will take us more time than the average dentist because dogs actually have more teeth than humans, therefore it only makes sense that it will take us more time. And most of you probably don't bite your dentist. Whilst you don't want to necessarily go, you're probably not as problematic to examine or put instruments in your mouth as pets would be. So hence the way we treat a pet with dental disease is very different to you going and seeing a dentist. As I mentioned, it is Dental Awareness Month in August, so if you have any questions or if you're unsure about your pet's breath, reach out and the team are more than happy to check. Otherwise, phone us on 5243 0077 and we'll organise a time to see myself or one of the team and check your pet's mouth. Keep well, guys. Bye.